Make a motion to accept the agenda for the meeting of Scituate Board of Health, Wednesday, June 10th, at the Selectmen Hearing Room. Second? All in favor? Aye. All right, schedule items. Discuss and vote tobacco compliance check violation, Dad's Place. If you guys want to come up and state your names and address and stuff.
My name Kirit Patel, 9 Amidon Road, Mendon, Massachusetts 01756.
Dipen Patel, 18 Standish Avenue, Scituate, Massachusetts.
Okay, so I guess we had a issue with selling jewels
To minor.
to a minor.
Yes.
That, well, Shones was fine, another place, but Dad's on Hadley Road was the one that got
Yeah.
stuck with serving to a 16-year-old. So I guess my couple of, are you guys aware of the different policies and the town and, you know, the carding of people and that?
Yes.
And what system do you have in place?
So like we are checking anybody seems like less than 40 years, checking IDs
Okay.
to check the age.
So what happened this night that, I mean, if it's a 16-year-old, he must not look like he was 40.
Yeah, so
Um,
we have been checking before that, but like on that day, like how we missed, like we actually didn't know like we had a violation until we got a phone call because I didn't get the letter for the hearing. So I didn't attend the last hearing, and then next day he got a phone call, and then we knew like we had a violation.
Yeah.
So it was like quite some time, so we couldn't like go back to the actual
Security.
transaction, like which one was that.
Mm.
But now like we are
Very cautious.
checking more than like what we were checking. Like we had been checking before, but now we are like more careful. Like everybody who works there, I told them like less than 40, you check ID.
Okay.
Yeah.
Do you have any systems, like there's a lot of places that will take the ID, scan it, take the ID and punch in the birthday?
Mhm.
Does your system handle something to that effect?
So like in some liquor stores, like close to any college, they sometimes have those systems. Like they are expensive every month. They need to pay. Like we are not like that big volume store. So like we check the ID if we have any doubt. Like we ask for any secondary
We have a-
evidence. Like if
We have a date in place on the register, so
Okay.
like
So do
we
they scan it, or do they
No.
just punch in a date, or they look at the date that's on the register and say, okay,
Yeah.
this is legal, or?
in our
not?
store, like we check the ID, and if anybody has like phony or anything, like we have any doubt, like we ask for any secondary evidence like passport or like credit card of the same name they have or not. So
Okay. Have you done, I mean, we kind of know the date that it happened. Have we done any coaching to the, all your employees, or
yeah,
that
after
employee?
that,
what happened?
after we knew about the violation, like we discuss everything with our employees again, like what we have to do.
because this Jewel, it's very hectic, and we had one student that like actually like we refused so many time, and he actually stole some of the parts, and we like right away
Report to police
report
too.
to the authority as well.
Okay. Do you have any questions?
No, I think you just have to make a policy that everybody gets checked. It doesn't
Yeah.
matter whether you think they're.
So like
free or
even
not.
cigarette customer, like 50-year-old too.
Yeah.
Yeah, I mean, a lot of places in town
Yeah.
have that machine, or they make it a standard process, no matter what age you
Check
get
every
card.
day.
Because, you know,
Yeah.
here being the first events, and I think this is the first offense for them,
Yeah.
it's kind of like a slap on the hand
Yeah.
and, you know, put some systems in place and go from there. But if it happens again, then it could, you know, like you talk about the machine, it could be an expensive piece of machine.
Right.
But
I can check.
if you lose your your tobacco license
Right.
for 7, 10, 15 days.
Right. So
That could be hard.
I am going to check, but what I have heard that like those machines are not like up to date, very up to date. Like some new IDs, like they issued, then it won't be in the system. So they have limitations too.
Right.
Like some are like very online, like they check every time in any computer there or server. They are expensive, like they want more money. But even though I will check like how much it is.
Yeah.
Like
and I mean,
if
the
we
other-
afford it, like we would definitely get it.
Yeah, I mean, the other thing is, you have a scan there, right?
Yeah.
I mean, so I can bring up a milk and scan
Yeah.
it and
Mhm.
stuff.
Yeah.
Some of those machines can be put into, so you take the ID out, you scan the ID, and then it comes up and says of age, or it will
Yeah.
say reject, or I don't know what, it comes up in some machines.
Yeah.
So
I mean, it might be worth it, like I said, first time we warn you, talk
Right.
about it, but they do these things all the time, not only the school or, you know, this department, the police department. Jewel is such a big
Mhm.
thing now,
Yeah.
that the federal government has put like $2 million, $3 million for police stations to do things, the FDA, everything like that.
Right,
So
right. We
it's
know
not just the
about it.
police, it's everyone that's out there.
right.
And it's, Jewel's just the biggest talk of the
Yeah.
town now.
Yeah,
Yeah.
because it attracts like younger people.
Right,
You should lock them up, and then when it gets stolen, and have every single person, you don't have to buy a computer
Right.
scanning system if every single person just automatically picks up the card.
Huh.
You know, you really need to make it a policy, every single person, and lock
Yes,
them
to
up. It's really inexcusable
Oh, okay.
for, you know, minors to be buying these types of
Right.
things, or even able to steal them,
Yeah.
because it's the same difference. They still end up getting it.
Yeah.
So you just need to really change your ways
Yes.
permanently, or you're gonna have a
Because
big problem.
we have refused so many fake IDs that we know
Mhm.
that, you know,
Yeah.
they are, because we know by their age and how they look.
But forget the
Like,
looks. The
yes.
look is not an
Yeah.
okay standard. That
Right,
is
right.
not
Yeah.
okay.
Yeah, we check ID.
now, do you take the fake ID if it's fake, right?
No,
You're
like
not
we
giving it
don't
back to
have,
them?
we don't have the, I don't know if we can, if we don't know that it's fake, but like
100%, but if
100%,
it looks
so we cannot
phony-
hold someone's ID.
Well,
Like,
you
like
can.
yeah,
And you
okay.
could- I mean, nine
I
out
can
of 10
call-
times,
yes.
if you take my ID and say, listen, I think this is fake, I'm gonna call the cops, they're either gonna get out of there.
Yeah, that's
or
what
they're
they're
gonna say,
doing. Like, you
fight
know, this
and
is
say,
fake
"No, it's
ID, and they
mine,"
get
then the
like,
cops
you
come
know,
And they can tell.
yeah.
I mean, it's just a practice that you really need to put in, because, and you could put a sign up, we card everyone for cigarettes and
Yeah.
tobacco products,
Okay.
you know, and put it on the door, big writing, and say it's a new policy. Like I said,
Yeah.
Yeah, if
to
we
lose
need.
a $5 ring
Right.
Yes.
is okay, but when you're losing, you know,
Right.
10 days of cigarettes and tobacco,
Right,
you
right.
could be talking thousands of dollars.
Yes.
Right. So we will put the sign,
We-
like
we
we
are very
will
cautious.
You
check
can write per
everybody's
Board
ID.
of Health,
Huh?
you
Yeah.
know,
Yeah.
you must check the
Yeah.
IDs.
Yeah, you can put that too.
Yeah.
I mean, then it's not like you're the bad guys.
Yeah.
Right.
We're the bad guys.
Yeah,
But-
because some people, if we don't put sign, like some people, they are like coming every day and aged, then they would say like, what a nonsense. But
Right.
we have to put the sign, like we
Put
are
it right
bound by
as you
the.
come in the front door,
Yeah.
on both
Yeah.
doors. And I would say, do you own Shones too, or?
Yes.
Yes.
I would put it there.
Both.
I mean, you know, your first couple of days, you're gonna get, oh, it's in my car.
Right.
I'm
Yeah,
sorry,
yeah,
we
yeah.
have to.
Yeah.
You know, you can even say we got caught and all that.
Yeah.
And we're just
Right, right.
tightening our policy.
Yep.
Police are checking on
Yeah.
this, yep.
Because if they did it once, they're gonna check you again.
Yes.
I know.
I
And
know.
if not,
Yeah,
the-
it's gonna,
the federal
we're,
government could
we're gonna be
send
on
people.
spotlight now.
right. And it's not just one,
Yes.
they'll go for both stores, so.
Yes.
Right, right.
Anything,
I'd just like to add, summertime is upon us.
Yes.
The population's going to swell. A lot of that population's going to be kids under the age of 21. They're not supposed to be buying any type of tobacco products. When word gets out and we get caught in a sting here, and you say that you ID all the time, all it takes is for one or two kids to be able to buy, get in there and, oh, I got away with it. Word gets out on the street very, very quickly. If you want to get it, go to this place, or go to this place when this person's working.
Right.
It gets out there quick. You just got to, as the board said, every single person gets ID'd. You don't go by the looks. If you want cigarettes, they do it
ID.
they do it at Fenway Park for an alcohol.
yeah,
Yeah.
70 years, 65 years old, you don't have it with you? Sorry, you're not going to get it. I got denied because my ID was expired
Yeah.
at the Boston
Yeah.
Garden.
To really-
So-
Yeah.
I
So
mean,
it's not
you're not the
available.
only one that's doing it, everyone,
Yeah.
every stadium does it for alcohol and,
Right.
liquor stores, everything. I mean, at the end of the day, it's worth it than paying a fine and losing your license. and
Right,
stuff.
right.
Yeah, protect your business.
Yes.
Yes.
Any other questions for us or?
If you have any other suggestion except these, like checking everybody's ID,
Yeah.
then we can implement that.
Yeah, I mean, that's all I would say to start, is make sure everyone's trained,
Yes.
what to look for. Because again, you're not there 24 hours a day. You're
Right.
not there from open to close.
Yes.
You got different
Mhm.
people, some adults, young, older, whatever. I would definitely make sure that everyone's
Everybody,
aware.
yeah.
Get the signs up as fast as you can. And
Yep.
Yeah.
like she said, Wendy said, you could put, per
Yep.
Board of Health.
Yeah.
And then just make sure they're doing it, because if they see the sign and you don't do it, then
Right.
we're back into the square one again
Right,
on
right.
that part.
Yep.
How many
Okay.
employees do you have?
Like we have two there,
Two
Two.
in total, two others in
two
total?
in the.
Mhm.
So there's just 4 of you?
Yeah.
So, should be able to sit down and
Yep.
say,
We,
Wanna work
we,
there?
as soon as we got the letter,
Yeah,
then
so
we
we-
did,
Yeah.
we did that.
yeah.
And then the other thing I would just mention is addresses, because you said you didn't get the letter.
Yeah.
You're in Mendon or something?
Yeah, I'm in Mendon.
Yeah, so make sure either with
Like
the Board of
if
Health.
it goes to the store, it's okay.
Okay. Is that what we have on file?
I think
don't
we
know.
might have sent it to the Mendon. I'm not sure if it's sent it to the store. We had 222 Hadley Road on the letter.
Okay, so that's the
That's
story.
the store.
Yeah.
I think I sent them to Mendon.
Okay.
Okay,
I did, with,
Yeah,
along
because I
with
remember
the
that's
food
what we
one.
have for the
Yeah.
address.
Yep,
Okay.
I did. I sent them both there.
so I would just make sure, because,
Yeah.
that's another thing of making sure there is a meeting or a hearing.
Right.
And like she said, any food permits go there. If you don't get those in time, then
Yeah. Right,
you're
right.
causing, can't sell certain products,
Yeah.
Right, right,
dairy
right.
or whatever.
Yeah.
Mhm.
Anything else? So, you want to make a motion just to, that we've discussed it and moving on? Is that what we should do?
Motion, place it on file.
Yeah. Just a motion placed on file.
Okay, I'm going to make a motion to have the tobacco compliance check violation placed on file
For
um,
dads.
for Dad's Place.
Second?
Yeah, Thank
All
you.
in favor?
Aye.
Okay,
Thank you.
you.
thanks. All right, Assistant Director report, or Director's report.
Pleasure to be here tonight, as always. We have 10 new septic plans that are under the 45-day review period. We have 8 sets of plans waiting for engineering revisions. 7 sets of plans are waiting for Concom review. We have 8 new private wells under the 30-day review period, and we currently have 17 failed systems in the books. We have started our swimming pool inspections for the season. We've already completed 3. I have 2 more scheduled for this Friday, and I'm not sure how many more we have after that. There's only like 1 or 2 more after that. So we're well on our way there. We will begin beach water testing on June 18th. I'm pretty sure the rec department is starting on the 21st, so we'll have that all in and make sure that all the beaches are safe. The the Scituate Health Department participated in an emergency dispensing seminar with regional partners last week, and myself and Eileen went, and hopefully we will be updating our own plan and offering training to new partners that we hope to bring into the process for opening up an emergency dispensing site. If we ever had to do anything on a grand scale for the entire community, we want to make sure we have a plan in place, and we're going to be reviewing that. And then we have also, I mentioned that we were looking to get serve-safe classes set up, because hopefully before the end of the summer, we'll be bringing before the Board of Health a package to accept the new food code from 2013, the new federal food code. That federal food code is going to require that they have a serve-safe personnel on premise whenever the business is open. Currently, they only have to have someone trained, and if that person is not on site, they can delegate that to a person in charge that is fairly familiar with the serve-safe protocols. This is going to require that every single establishment have a serve-safe person on site while the operation is open. So we've scheduled 2 classes for the last 2 Mondays in August, not counting Labor Day, which is going to be in September. And it's the sailing program is over. We've scheduled them for down at the Maritime Center. We'll be sending out an email to all of the restaurants, strongly encouraging them to, send as many employees as they can to it. It's a pretty reasonable price, $140 for the entire class with the book. And I believe if you just want the book to retest, just the book is, I believe, $40.
Yeah, the book is $30, I think.
And then
we
the-
have somebody that does it, that's gonna come
Yeah,
in
a
and do it.
gentleman by the name of Al Scolio. He's done it for about 20 years. He's out of Marshfield. Joe Murphy from our office hooked us up with him, so
And they
it's
can
going
come
to
in
be
and just
really
take the test
successful.
as well.
So if someone's had it and just see.
Right.
They need to be,
Right.
yeah, every 5 years it has to be
Right.
redone.
So they need to
So they can just come in and
Yeah.
take the test?
They may just want to buy the book, or yeah, and however it is.
And then if they do the class, how long the class
It's
is?
an 8-hour class. It's usually, we have the room reserved 8 to 4. The class usually goes 9 to 1 or 9 to 1:30 or 2, and then it's 2 hours to take the exam. The exam's 80 questions, and I believe you have to get something like 68 right or 65 right. It's somewhere in that area there. But we'll be getting people signed up for that. We can have probably as many as 30 people per class, so if we can get, 20 to 30 people in each class, that would be really phenomenal. But the good part is, it's local, it's on a Monday. Those are days that restaurant people usually have the most time to have someone go off and take a full 8-hour class. So we're really excited to get this out.
And that would be for, now what happens if you're getting swamped with all the restaurants and, stores and that?
To be recertified,
Would we do
if
another-
we would do, absolutely, we would do another
Okay.
class.
And is there a drop deadline that's gonna be a law?
We would,
You have to adopt
it
it.
depends upon when you adopt it, and you can adopt it under the conditions of this is going to go into effect, January 1st, 2020. We just
Okay.
haven't brought it forward to you, but you can,
We're trying to educate all the food establishments first, so they know what the change is. So, because once you adopt the 2013 food code, now they're out of compliance and they're in violation. So
Right.
we're trying to avoid.
we want to get them all in compliance and then approve it.
Right.
No, I agree.
We want them ready, so they all know.
All right. Anything else?
That's about it.
Other business, administrative, those are done? Make a motion. No, she's watching you.
I'm a nursing student.
Oh, okay.
Oh, and you had to come to a local Board of Health meeting. And what school are we going
Would you
to?
like to talk a minute? or-
Sure. I'm in a master's program at Regis in a health policy class. So yes, I have to attend an in-person meeting, Board of Health preferably, so.
Not every city and town has one. I used to get requests all the time, and I'm like, Quincy doesn't do it. You go to, Braintree does Board of Health meetings, Hingham, places like that. Some
Yeah.
cities and towns just don't.
I'm in Hanover, so it
Yeah.
wasn't too far.
Well, we should have had a longer meeting.
We do have longer ones.
Okay.
I make a motion to adjourn.
Second, all in favor? Aye. That's it. Look at you, got a short night.